Today, as we're trying to do for you every morning on our program, we're bringing in experts to answer your questions to help you through some of these most pertinent issues during this pandemic crisis. And this morning, we're going to focus on your mental health. Dr. Peter Selby is going to be with us this morning. He's the Chief of Medicine in the Psychiatry Division at the Centre for Addiction and Mental Health, CAMH, which is Canada's largest mental health teaching hospital. It's one of the world's leading research centres. He is with us all morning from his location there in Toronto. Dr. Selby, I'm just delighted to have you on our program, and thank you for agreeing to be with us and answer our viewers' questions today.
Thank you for having me.
I would like to get your gauge on where we stand. This morning, we're talking about, as I said, those twin anxieties about the future economically speaking, our jobs, our families, getting food on the table, paying our rent, twinned with, am I going to get sick with this very worrisome illness? How are you reading Canadians' state of mind right now?
So I think it's a range. It's completely appropriate to be, to be worried and to have concern about, about all the topics that you mentioned, but as well as for others in our lives, especially if we're caring for elderly parents and, of course, ourselves as well. So those are the kinds of things that obviously weigh heavily. Now, so that's appropriate because it allows us to take action. And that kind of concern and worry means we plan a little bit. We actually, we listen and heed the public health advice, which is exactly what, we are all in this, not for ourselves, but for each one of us, like for collectively. So that allows us to do that. It allows us to plan. Having said that, there is uncertainty, and how to manage under uncertain times for some people becomes a little harder than for others. So we do have to help people manage that level of concern that reaches a point where it can potentially become paralyzing, or unfortunately lead to panic. And during these times, it is really important for all of us to manage that anxiety well. But we are seeing that people are getting anxious, and of course, people who have yes, absolutely.
But I like what you said about taking action and regaining control. So with you today, I want to help people find solutions and dealing with all of the emotions that they're feeling. They're concerned for their loved ones, they're concerned for their children. So we're so happy to have you for these 4 hours. Yeah. When you talk about taking action, CAMH has already come up with a tool to help people. I'm going to bring it up on screen. Just yesterday, you put out this website to help people navigate this, to help them answer questions. I think we're going to be able to show that. Hold on with me, Dr. Selby. So people know exactly what we're telling. But maybe as we wait for that, can you tell us, here it is here, can you tell us what the intention was and what this website offers?
So back in 2003, during SARS, we felt that people were, at that time too, were reaching out because they were getting concerned, worried, anxious, and a range of those emotions. And once this pandemic started coming forth, we started hearing people talk about it. And of course, you hear from your children, your friends, worry about it. And so we felt we should be ready for that because we predicted that people would be anxious and get anxious and get concerned. So as pandemic information comes out, a lot is paid attention to what people have to do, but not the impact on their mental health. And so we got a group of us together at CAMH, including psychologists, psychiatrists, and psychotherapists, and we came up with this resource to help people understand that some of this is absolutely a normal reaction, and then provide practical tips on what people can do to manage it in the moment.
Well, we are going to direct people there, camh.ca, and then you follow the links to this particular website. But we're also going to do that together this morning on our program in answer to viewers' questions. So, Dr. Selby, stand by with me, and I'll be back to you later in this hour. It is a time of changed routines and of anxieties that come from that, losing control over what we know and what is familiar, given the pandemic and the conditions we're living now, with states of emergency in effect in so many of our provinces. We're talking about how you're dealing dealing with those concerns and how your mental health is being affected in times of crisis, and answering your questions with Dr. Peter Selby. He's the Chief of Medicine in the Psychiatry Division at the Centre for Addiction and Mental Health, Canada's largest mental health teaching hospital and one of the world's leading research centres. We reached him in Toronto. We have been having wonderful conversations. Looking forward to this hour. Dr. Selby, let me just quickly pick up on that Nixon story. Parents doing everything they can to try to keep things as normal and try to celebrate. What are you seeing, and what are you hearing from? What should we understand is what is normal to feel at a time of such upheaval in our lives?
So what is normal is to obviously worry about the immediate issues around the necessities of life. Am I going to have enough food, water, clothing, etc.? Supplies, all of those issues. That's the immediate. And then, of course, there's other worries that people have about job, finances, etc. So it can be quite individual. Of course, there are other worries that children have that, well, their parents get sick, other people get sick, themselves get sick. And then it's more immediate. It's very simple. Look, my birthday party got canceled. Mm-hmm. And it's age appropriate kind of responses. So I think you get this range of responses that are sort of within the realm of normal. You do see people going out and planning ahead and so trying to make sure that they have supplies. But sometimes it can get excessive, and we've seen some of that, whether it's people, behaviors that are, it's understandable what is getting triggered in people to go and try to hoard food or try to go hoard, toilet paper and those kinds of things. But on the other hand, it can become excessive, and so finding the right balance is critical.
Well, help us find some balance, because Kimberly Soloway wrote us a question, how she's obsessed with watching the news at this time, and we appreciate her viewership. Kimberly, thank you. As we talk about the pandemic, she says she tries to turn off the coverage to give her emotions a rest, but that only creates more anxiety within her because she doesn't know exactly what's happening. Any suggestions for that?
Well, the news cycle, unfortunately, is the same news sometimes being, put out on the hour or every 15 or 20 minutes, and every channel is covering it. So you could get yourself, activating your body into feeling that something really bad is happening immediately, and you need to be glued to the television to know for the latest breaking news. Unfortunately, that's not very good for our brains and our system that has to do, and our system that involves the protective system called the flight, fright, freeze response. And so often if you just suddenly stop watching, then your mind is still obsessing, oh my God, I'm missing out on something mm-hmm. bad is going to happen. And that's why we've given some advice on the CAMH.ca COVID-19 response, is for people to figure out how to manage and regulate that distress that this can cause, how to step away from it. But again, we often say a simple thing is when people are stepping away from something negative is engage in something positive. Telling somebody to not think about something can cause more distress because you have to think about something to not think about it. So that's why if you tell somebody not to think about that mouse in Florida who has big ears and lives in Disneyland, immediately your mind is thinking about Mickey Mouse.
Okay.
So you have to distract yourself to something else.
Can that be something like meditation or a walk in nature or listening to beautiful music or finding a moment's peace and calm and joy in any of those things?
Absolutely. A range of distractions, whether that's exactly as you mentioned, meditation, talking to other people, doing other activities, keeping busy, is critical during these times.
Quick question from Elise Hamill, because I promised Elise I would get this to you this time round. From Moncton, New Brunswick, many people, as she is, working from home. It's a new reality. What are the best practices for managing on our own, as she writes, because management's expectations may not be possible to achieve as productive as we were in the office, it's not quite the same routine and not as productive, whether we're taking care of loved ones or because we're trying to process the situation. So any ideas and suggestions to better manage on our own in the home workplace scenario?
So I would have clear communication of what is expected and how do you adapt to that reality, because part of it is when you are home, and especially if you have multiple hats as a parent, as a caregiver, your work and home life sort of now blend into each other because you're available and accessible. Whereas when you're at work, and when you're at home, you're at home. And so you have to set some limits and figure that out. Now, of course, it's different for everybody because some people live alone, some people live with families, etc. So you have to make sure you set a routine and structure it. You don't want to be having to, all just letting it go and, just not having a structure to your day. That can really help manage your own expectations of yourselves and that of others and say, realistically, this is my availability. Realistically, this is what I can do. Make sure you take the breaks that you normally would have, whether it's stepping out onto your balcony or getting outdoors for a minute to get some fresh air. Do something different, or even if it's exercising in place, do something that gives you that break. Make sure to have your meals and make sure to get your rest and make sure you do those kinds of things. The self-care during this time is critical, but communicating and understanding the expectations from your employer is also an important one.
Dr. Selby, I so appreciate our time with you today. You're only with us for this hour, so we'll have to leave it at that. But we'll be carrying on this conversation because there's no doubt the mental health aspect to this is an important one. And direct people again to that new website you put up yesterday, camh.ca/COVID-19. Thank you very much for answering our viewers' questions, Dr. Selby.
My pleasure, and thank you for doing this show.